Okay, welcome to Just Chillin', the City of Cleveland program dedicated to issues relevant to today's teens. Tonight we're talking about asthma. The number of the station is 368-2207. We'll take your phone questions after the interview. Thank
you. Stone Cold Steve Austin here with a short message for the kids in Cleveland. I ain't one of the pack. I do my own thing at the World Wrestling Federation. I don't give a rat's what anyone thinks as I stand on my own. Be like Stone Cold, be your own man. You don't need drugs to make you strong. You just need yourself. So stay strong, be yourself, and say no to drugs. And that's the bottom line, cause Stone Cold said so.
Okay, welcome. At this time, can you introduce yourself to Cleveland?
Well, I'm Walter Clark, and I'm a medical doctor. I'm also medical director for Northeast Ohio Neighborhood Health Services Incorporated, better known as NEON, but also affectionately known as Huff Norwood. And we have some 5 health centers scattered across the east side of Cleveland. And we've been in the community serving folks for about 32 years. I represent about 25 primary care physicians, another 6 or 7 or 8 OB providers, midwives, and physicians, and a number of dentists and optometrists, podiatrists, and just a whole heaping amount of providers serving our community. And what we do basically is we get a lot of assistance from the federal government to the tune, $8.5 million, maybe around that amount, to assist us in serving folks without regard to their income. And the federal government has been gracious enough to rely on us for as many years, 32 years, to serve the citizens of greater Cleveland in terms of their health care needs.
Okay, Dr. Clark, a little information about you yourself, growing up, high school, college.
Well, Lynn, you ought to know kind of a little bit about me, and from that standpoint, I grew up right across the street from me in the hood, where right in the Huff neighborhood, where I kind of got my start and went to Doane and John W. Raper and a few other elementary schools around, Daniel E. Morgan and so forth. And around when I was 15 years old, went to Empire and got identified as someone who perhaps could take it a little bit further, and got hooked up with the ABC program.
Okay.
ABC program was a scholarship program to provide inner city kids an opportunity to branch out into other things related to the mental improvement area. And so what I did, got hooked up with a prep school, actually several prep schools. I won't tell you that story, but I went to a couple of prep schools and finally went to Williams College in Massachusetts, and went from Massachusetts to Washington, D.C. to Howard University, and graduated or got out of Howard when I was, I guess, back in 1978. So I've been a physician for about 22 years, did a little internship at Mount Sinai before it closed, and then went down south and did some work for the federal government, being one of the few physicians working for a community health center operation down there as well. And then from there, decided to come back to Cleveland back in '88. First place I decided I wanted to work for was Huff Norwood, again known as NEON now. And about 5 years later, I became the medical director. So
That's pretty
that's
cool.
a little bit about me.
Okay, we're talking about asthma tonight. I guess for our audience, what exactly is asthma?
Well, let's pretend you're my patient, and
Okay.
I'll tell you what I would tell my patient. Basically, it's an unfortunate condition, but it is characterized by sort of twitchy, itchy, irritable airways, little bronchial tubes that pretty much get very close, get the air close to your blood circulation, so as to allow air to seep through the bronchial tube into the arterioles to carry that oxygen to the heart, so the heart can do its thing, get the blood out to the circulation. Well, the problem with little bronchial tubes is they have a little smooth muscle that kind of surrounds them, and that smooth muscle can get a little tense, and under certain situations like inflammation, which is often the situation in asthma, this little twitchiness can give rise to shortness of breath, because in essence, when those little bronchial tubes close off, your opportunity to get air to your blood vessels is compromised, and therefore you have the sense of suffocation. This suffocation is the result of, and it's reversible. It's not an irreversible condition. It's reversible, meaning that there are certain things we can do to make that issue resolve itself. And it's a very frequent, common problem. I mean, we're talking about better than 15, 16 million people in America have this condition, and it sure felt like I saw all of them last Friday at the health center. I mean, it was before 11 o'clock. I had taken care of 6 people with asthma. I had folks all over the place in my exam room, in my office, on nebulizing treatments. I mean, it's an interesting problem. And you know, there are lots of things that are associated with asthma in terms of the twitchiness, the itchiness, the irritability to the airways. And I hope I'm not talking too fast, because this is pretty much, I only have so much time when I'm seeing a patient, so I have to squeeze a lot of talking in, so I'm becoming motor mouth, I can imagine. But the fact is, there are lots of things that can give rise to this irritability, things like allergens. I mean, for instance, if you have a history of sinus problems, allergic rhinitis, things of that sort, and then you tied it in with some asthma, oftentimes the same things that you're allergic to in terms of bringing on the itchy eyes, the sneezing, things of that sort, are the same kinds of things that might promote or prompt or create an irritability in your lungs if you have asthma on top of that. Some folks are allergic to cockroaches, and some folks are allergic to cats, warm-bodied animals, dogs, and things of that sort. And so you have to kind of rule out those kinds of issues, but they are associated with asthma. Smoking is a problem. People in the household who smoke can give rise to the irritability, the twitchiness, the spastic nature of the little muscles that surround those bronchial tubes that cause the squeezing and the restriction of the airflow, and therefore less oxygen, and again the feeling of suffocation.
Okay, I guess, Doc, my question as a patient would be, how serious is my condition?
Well, it's good. The good news is that asthma is not necessarily associated with increase in mortality, but the sad news is that some people do die. As an example, you look at a mortality rate and say per 100,000 people, and I'm not a statistician, so and I'm not
for young people, what's the mortality rate?
Well, you know, it's a blended rate. It's not that common that is death and mortality with asthma. I mean, we're talking about a number anywhere from 3 to 3.5 per 100,000 people in the population. So that's a small number, but guess what? You know, you're talking about black children or black folks in general with asthma, the mortality rate, though small, is twice as much as it is in white patients or in the population in general. So that's just an interesting note. But it's probably more the morbidity of asthma is of greatest concern. I say morbidity, that means the types of things that when it happens, that is when asthma affects your life on that particular day, what does it keep you from doing? Like going to school. That's the biggest thing. Going to work. That's probably the second biggest thing, at least for adults, and that's a concern. Having to go to the emergency room and spend a couple hours there. I mean, that's hazardous to your health to spend any time in an emergency room, not only because of the treatment you need, but you never know what comes in that emergency room. You may be exposed to it. But that's the morbidity of the condition, and in terms of loss in days of work, that affects the economy. In terms of loss in days in school, that affects your mind and your opportunities to improve upon your position in life. And that is the greatest problem when it comes to asthma affecting kids. The fact that it does create problems for you in terms of going to school. As it turns out right now, I'm part of a Greater Cleveland Asthma Coalition. And it's a large consortium of folks representing broad community agencies, institutions of learning, hospitals, and healthcare providers. I'm on the steering committee, and we've been doing a lot of work, at least as of late, to focus on school, as an example. Focus on why and how, what can we do to keep kids informed in terms of about their disease, so that they can improve upon their show rate at school and therefore decrease in absenteeism T-ism. And so that's the kind of thing that, that I'm involved in right now.
As a student, I'm active in football, so
yeah.
What's your concerns for me?
Well, my first concern is do you know how to use your inhaler?
No.
And where is your inhaler?
Okay.
So that's the first question. I mean, when you come in and I say, where is your inhaler? You have asthma. You know you have asthma. You know. The last doctor you saw said, always keep that inhaler with you. Which inhaler I'm speaking of? The inhaler I'm speaking of is the bronchodilator, and it comes in many forms, but there are short-acting, quick-acting types of medicines that are considered your rescue medicine that you must keep with you at all times, though there are other medicines you can take to kind of keep the inflammation down over time. I don't want to talk about that right now. But for sure, where is your inhaler? That's what I'd ask you the first thing. So you pull it out. Okay, so you have it. You pull it out and I say, well, okay, show me how you use it. I know how to use this inhaler, as most kids tell me, especially the younger adults who just got beyond their adolescence. And I know how to use it. I have asthma for 10 years, off and on. I've been using this inhaler, so I know how to use it, doc. I said, okay, well, if you know how to use it, show me how to use it. Most folks put the inhaler right in their mouth, close their lips around the mouthpiece of the inhaler, and I tell them, stop. Don't even try. Don't go there, because that is improper. In fact, as it turns out, most of the folks that I see day one don't have a clue as to how to use the medicine correctly, number one, and number two, don't know why using it correctly is of benefit to them and will be of benefit to them. So usually by the time I'm finished seeing a patient with asthma, I'm hoarse because I'm talking like I'm talking right now, trying to fill in as much information within the 15 minutes that I have to see them. But I would ask you, show me how to use the inhaler. And it's very important in using it correctly, holding the mouth kind of wide open with the mouthpiece just a little bit outside the mouth, head tilted back just a little bit so that it kind of opens the airway so that the trachea communicates with the mouth a lot better. You know, if you lean your head forward like that and take a deep breath and bring it up like that, you notice the difference in terms of the airflow. So you put the mouthpiece right outside your mouth, let a nice breath out, and then you, at the same time you're pressing the medication, and you take a deep breath in. And then you hold it. I tell them, hold it for the count of 10 seconds. Well, how do you count 10 seconds? Most of the folks I'm seeing these days don't have watches. So a good way to count out 10 seconds is 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, and so forth. And you can count that in your mind. So you hold it for like 10 seconds, and you wait a minute, you do the second puff. And I tell them why. The important thing is that with the rescue medicine that you're supposed to have in your pocket and be able to present to me at any time, since you know you have asthma, well, you use that first puff, you hold it for about 10 seconds. The reason you wait is because it gives that first puff an opportunity to do its due in the airways, open up those airways as much as it's going to do, and then about a minute later, the second puff takes advantage of the work done by the first puff. You do it too quick, and it's just like I tell my patients, it's like football. You got a blocker going to create that hole, but the running back hits that hole too quick, it ain't going to be there. So you got to get the play time to develop and the blocker time to open up that hole so the running back can take advantage of the hole created. You may not get about 10 yards down the line. Therefore, you have to repeat the medicine maybe 20 minutes later, maybe an hour later, maybe 4 hours later, maybe 6 hours later. But in any event, using it correctly and using the benefit of the first puff is what I tell my folks what to do. Oftentimes, the first thing they tell me is that they put it in their mouth, take some of the medicine in, and then as soon as they let that one out, and they don't hold it for but a couple of seconds, they take it another puff. Obviously. That is incorrect way to do it. And the reason you hold it outside your mouth when you're taking the medicine in is so that you take advantage of the air to help escort the medicine, this little bit of medicine that's in that canister, into the farther reaches of your lung. And that's what I tell my patients. And furthermore, maybe you got a question?
We're going to take a music break.
Okay.
Listen to a song by Average White Band, TLC. Once again, the number of the station is 368-2207. That's 368-2207.